Good afternoon, and thank you for joining our daily briefing. With us today is Supervisor Nathan Fletcher, who is the co-chair of the board's subcommittee, and also Dr. Eric McDonald, the medical director for the County Epidemiology and Immunization Branch. Today we're going to hear an update about our case numbers and our testing for COVID-19, and we're hoping to illustrate that information through a series of graphs and charts to stress the importance of the measures we are taking to slow the spread of the virus. We talked yesterday about our efforts to model the future path of this virus, and we're going to hear more about that today from Dr. McDonald. Finally, I'll provide some information about community resources and what people can do to help us through this crisis. Let's get right to it, and I'll call up first Supervisor Nathan Fletcher.
Thank you, Supervisor Cox, and good afternoon. There's been a lot of discussion nationally in a lot of different jurisdictions about the timeline, the process, kind of where we are. There's been speculation about when things will change in terms of our posture. And today we want to convey the unequivocal and very clear message to San Diegans that in San Diego we are at the very beginning of our exposure and our engagement with the coronavirus. The situation that we face in San Diego will get worse and continue to get worse before it gets better. That means in the coming days and weeks we are going to see more positive cases, we are going to see more hospitalizations, and tragically we will see more deaths. The actions that we're taking will help mitigate that and will help make it less bad if we all come together and adhere to these measures. And it is really important. You know, a lot of individuals will say, well, I don't know anyone who has it. As Dr. McDonald has stated, the estimate of the number of positives we have based on limited testing is not a reflection of the true number of cases in the community. The estimate that's put out by our public health experts is the real number is probably 10 times greater than what we are reporting. So we are doing everything we can to flatten the curve. The stay-at-home orders, the physical distancing orders, the hygiene orders, the things we're doing will help us get through this, along with the efforts to increase the capacity and optimization and enhancement of our healthcare system will help us work to fight valiantly to ensure the healthcare capacity system remains. But those will only be successful if each and every one of us truly commit ourselves to taking action and the actions that have been directed and ordered in order to slow the spread. And so I do think it is important that we need the public's continued commitment, we need the public's continued engagement, and we need you to understand that we are at the very beginning stages of this. And it is very serious, and we take it very seriously, and so we're asking for the public's continued help in the efforts to do this. We want to graphically share a couple slides. We'll go to the first one here on test cases. These are slides that we will begin updating on a regular basis in order to provide the public with more information. The first slide that you see in front of you represents the testing has been reported. The blue bar representing the total number of negative tests reported back to us per day, the orange line being the total number of positive tests reported to us by day. It is very important to note that for a long while, negative tests were not reported back to us. So not every test that was done in San Diego County is reported on this slide. These are just the results that were shared with us. We are getting much better cooperation amongst the entities that are testing, both the community testing as well as the labs that are testing. And we are hopeful and remain optimistic that we can continue to see an increase. But this slide represents from the early days when it was only CDC testing into a phase where we had limited capacity here locally, and now into a phase where we will continue to do this. But this slide does not represent any tests that are being processed. These are only ones that get reported back as negatives and positives. We do believe every positive test result has been reported back to us since the beginning of our involvement in this. We do not believe every negative test has been, but we will continue to update this with all of the information that we have available, and we will share that in real time. The second slide you'll see is a representation of the total number of new cases. The blue line, which you see on your slide, is the total cases on a day-by-day, starting with our first diagnosed case on March 7th to the current total on our website of 242. The orange bar represents the day-over-day total of new cases. And again, it is really important, and we want to remind everyone that the concept of exponential growth means you can see a rapid uptick. And as community spread continues, as better testing becomes available, as the severity and impact of this really takes hold, we fully expect these numbers will continue to increase, which is why we are asking the public today. If you wait until it appears that things are out of control to act, you have waited too long. Which is why in San Diego County we were one of the first jurisdictions to declare a public health emergency, one of the first jurisdictions to put in place physical distancing measures, and why to this day we continue to ask for the public's help and cooperation in adhering to these orders and these guidance in the best help we can preserve our healthcare system and get through it. Next up, I'm going to introduce Dr. Eric McDonald, who's going to share information, updates, some data, some key points. And then Dr. McDonald will also be presenting some modeling information along with a sense of giving folks an effort of what we're trying to achieve in flattening the curve, raising the capacity of the healthcare system, and I think will really bring to light the importance of everyone adhering to these measures. Dr. McDonald?
Thank you, Supervisor Fletcher. Just to elaborate on the cases that have been reported so far, there have been 242 cases reported so far. 226 are San Diego County residents, and 16 are non-county residents. The proportion of non-county residents will decrease as increased testing occurs locally, and we will, after today, no longer be reporting on non-county residents to be consistent with all of the other diseases that are reported and other counties that are reporting only on their own residents, so there's no double counting. It's worth noting that of the 226 San Diego County residents, almost 20% of them were hospitalized, almost 9% required intensive care, and 1%, almost 1%, have died. The youngest patient is 6 weeks old. The oldest patient is over 80. And it's also worth noting that 4 out of 5, or 81%, of the cases diagnosed so far have been between the ages of 20 and 59. So I want to just emphasize those numbers again: about 20% hospitalized, about 9% needing intensive care, and about 1% deaths. That's actually very consistent with what's being seen in other parts of the country and indeed in other parts of the world. And if you could put this next slide up for me. Here we go. I'm just showing an extremely simplified model of why it's important for San Diegans to be very conscious of their activities, to stay safer at home, and if sick, to absolutely self-isolate at home, because these are the major interventions that we have now to shift the curve down so that we can handle the number of cases that we anticipate. If you look at the beginning of the dotted lines here, that's about where we are right now with 226 local cases. And you can see that if the cases double every 3 days, which is what one might expect if there weren't any good interventions in the public, the numbers go pretty quickly past the line that goes that's labeled historical bed occupancy, which is about 50%, and then actually fairly quickly in early or mid-April to the limit of the number of non-federal licensed beds that are in the county of San Diego. And if we look at the green line that's on there, if we can do the proper social distancing, staying at home, and other interventions to make sure that we do not allow communication of this disease between people, you can see a marked shift downward in the number of cases that are reported, doubling every 6 days instead, and we don't reach the historical bed occupancy of about 50% until May, and then we don't exceed the number of non-federal beds in the county until later in May. Now, this is a very simplified model that's based on 20% hospitalizations, people being in the hospital for about 7 days, 9% ICU cases, 1% of patients dying. It assumes that all beds are available for these patients, which is not true. It means that it also assumes that there are no surge additions and no military beds, and that testing is relatively available. I'll draw your attention again now to the red line at the top that says non-federal bed capacity. We know we have 2 naval hospitals and a VA hospital here, so we know that line is a little higher. And we know that the efforts that are occurring within the hospital system by canceling elective surgeries, by realigning services, by establishing outpatient testing facilities, and other important interventions with both supplies and staff, that the number of available beds will in fact go up. We estimate in the state of California that the hospitals themselves will be able to increase their capacity by about 40% if everything is optimized, and we hope that there will be even a higher amount of bed capacity if we get assets from outside the county, such as federal assets. So that red line is artificially low even for what is present now, but will in fact increase with time as the hospitals prepare for this surge of patients. So that's the other aspect of what this chart is showing. Number one, why it's important to push that blue curve into a green curve to buy time, so that the red line actually increases and we're able to, in fact, take the load of patients that we are expected to have. I know that's a very simple way of explaining this, but the two important points are what you are doing today in your homes by eliminating all non-essential activities and by doing social distancing and the other recommendations that have been put forward, as well as the orders that have been put forward both locally and at the state level, are going to in fact have this effect, and we need to keep with it. It's the main message that we want to give. I do have a couple of other updates quickly. You can maybe get off the slide. That's good. I do want to quickly mention that the operations at Miramar are in fact winding down. Tomorrow should be the last day that the last group of individuals who were there for quarantine will in fact finish their quarantine and be leaving Miramar. There will be a small number of individuals that will remain in federal isolation because they in fact have the COVID virus and are still being monitored, but that operation should be winding to a close very shortly. Also have a brief update on cruise ships. People will see cruise ships coming in and out of the port in San Diego. There is one ship, the Westerdam, that will be coming in merely for supplies, will not be actually disembarking any individuals, and two other ships, the Masdam and the Celebrity Eclipse, will be coming in over the next 5 days. They will be disembarking passengers and a very limited number of crew. We've been working with the CDC quarantine station, the CDC cruise ship task force, the port, Cal OES, the Coast Guard, and other entities to monitor those vessels as they come in. The vessels that will be disembarking passengers will each have been at sea for longer than 14 days, and we know at this time there is no influenza-like illness on those vessels. So as they approach, as long as they have no other reported illnesses, they will not be representing any concern for San Diegans as they disembark, go to the airport, and go to their various homes across the country. Those are my specific updates, and I'll be ready for questions at a later time.
Thank you, Dr. McDonald. We're going to go straight to the questions now. Again, we would ask you to state your name and your outlet. Please keep your questions to one question and a follow-up. If you have more questions, you can call back again and get in the queue. Let's go ahead and take the first call.
KUSI, please state your name and question.
Hi, this is Hunter Sowards with KUSI. And first of all, I just want to say thank you so much for these daily updates. I know that a lot of people depend on them. And I'm seeing here in one of the graphs that y'all put up says that the total number of reported tests is 3,464. And I'm wondering, in the future, I know that a lot of people are wondering if it's going to be possible to make these more widely available, but is that a priority right now in San Diego, or what's holding us back from being able to specifically offer more tests?
Dr. McDonald, answer that question.
Thank you very much for that question. That is really a question on everyone's mind. I can tell you that every health system in San Diego and the public health department is working with various vendors to make sure that platforms that can run the test are being established as quickly as possible, that the staff to run those platforms are available and trained, and that the reagents, that is, the pieces that are required to make the tests run, are in fact also available. We expect that within the next week, the number of available tests will increase dramatically within the hospital system, and we hope that tests will become available that may be indeed point-of-care tests within the next couple of weeks. We have local entrepreneurs and research labs in San Diego who have reached out to us, and we're working with them to make sure that the tests that they have, in fact, do what the tests need to do, which is tell us if a positive test really means it's positive, and if a negative test really means it's negative. And that is the role of our local public health lab, is to make sure that that's correct for the tests that are being used here, and then they can be launched to the wider population.
Thank you.
Okay, next question.
KSDY 50, please state your name and question.
Hi, good morning. Since the governor this morning extended the quarantine for 12 weeks, what about the measures that are going to be taken about the border crossing the border crossing essentials? As it was going to be only for 30 days. How this is going to reduce the risk of provide the COVID-19?
Okay, Dr. McDonald's going to answer that one.
I can answer part of that question. I can tell you it gives me a chance to highlight our close cooperation with the Mexican health officials in Baja California and the Mexican Health Ministry. We're in contact with them every day about cases that are occurring in Baja California. They have a much lower number of cases than have been reported than we do, partly because of their testing capacity, but partly because I think they're a little farther to the left on the curve in terms of the number of cases, but they indeed are likely to be on the curve also, and they are extremely aware of that. The specifics of the border crossing needs to be addressed to the federal authorities that control the border. So the CBP is best able to answer that question, and we do work closely with them. When there are individuals that are identified at the border who are ill, there are mechanisms in place to make sure that they get expeditious care or in fact are isolated if they need to be. But the details of that question I would refer to the federal government.
Thank you.
Okay, next question.
Union Tribune, please state your name and question.
Hi, David Ward from San Diego Union Tribune. Question again about compliance and what's going on countywide, because we've heard about golf courses that are still open and car dealerships that are still open. What can the county do about that, and is that a big concern at this time?
Supervisor Fletcher is going to respond to that one.
Thank you. We continue to reiterate our call to the public, and we ask them to heed the advice, heed the orders, the directives that have been put forward. It should not require law enforcement of things that are designed to protect the public and designed to protect each of these individual folks. The sheriff was here yesterday. He spoke to their enforcement posture and how they will be doing that, and the sheriff can provide further advice and guidance on the specific actions they will take, as can the individual jurisdictions and their police forces in each of those. We've seen some jurisdictions that have had challenges step up their orders, step up their closures, step up their policing of those areas. But we really are asking the public that it should not require law enforcement to get you to do the things that are in your own best interest. And so we're hopeful that we can continue to get widespread cooperation from the public. Thank you.
Okay, next question.
NBC 7, please state your name and question.
Hi, Artie Ojeda from NBC Channel 7 News. Dr. McDonald, you said today that 81%, an overwhelming number, 81% of people who are testing positive are between the ages of 20 to 59. What do you make of that? And as we begin to test more people, do you expect these numbers to remain consistent with that particular age group?
That's a really good question, and I think it's actually a complicated answer in the sense that what our positive test results tell us is only a small glimpse of what's really going on in the community. And there is something called testing bias, that is to say, if you're only testing certain groups, you only learn about certain groups. And we know, for example, that our colleagues in the military are using their Navy Health Research Lab to do testing and are able to do testing on active duty individuals relatively quickly. And they are disproportionately represented as a younger group of individuals. We're also testing more aggressively healthcare workers and emergency personnel who also tend to be a bit younger. So that may skew the number of individuals that we're getting in that group. On the other hand, we are testing very aggressively hospitalized patients who tend to be older. And really, I wouldn't make much at this early stage when we really don't know much about what's below the waterline. I've said before that what we're seeing is the tip of the iceberg. We don't really know how big the iceberg is and how wide it is, and what constitutes the ice below the waterline compared to the ice that's above. So I think that it's a complicated answer, and I really wouldn't make much of this at this early stage in these low numbers.
Okay, and may I follow up with a question on personal protection equipment, because we continue to hear from healthcare providers on that issue. We hear help is on the way from federal and state officials. What specific details are you all hearing about when it will arrive, and how will you prioritize who gets it?
Okay, Rob Sills, our Director of Medical Operations Center, is going to answer that question.
Thank you, Artie. I know that I reported back a couple of days ago that we were waiting on the Strategic National Stockpile that came through the state. We did receive that. We offloaded, we took inventory, and now we're able to prioritize and fulfill requests that have come in. We received about 30% of what we asked for, and we have already submitted our next request up to the state. And we, before I came over here, got confirmation that we're going to get delivery on that tomorrow. Again, not everything we asked for, but we keep tracking. We're working very closely. I have a call that started about 10 minutes ago with all the incident command centers at all of our healthcare facilities that treat and assess patients. And we are talking about that very topic of getting real numbers of what they have and what they're projecting that they need. And I believe the second part of your question had to do with how are we prioritizing? This has been very consistent since we started this at the end of January. We are prioritizing our resources that we have within the county as well as the state for the healthcare workers and the patients that are active COVID-19. The healthcare workers that are actively assessing and treating those patients, as well as the first responders that are transporting and dealing with those patients. So I hope that answers your question.
Yeah, well, 30% of what you asked for, what specifically did you ask for, and what specifically did you get?
You know, I have it's about a 30-line spreadsheet on that ask, but it's the PPE kit. The main part of it is the PPE kit that we talked about. Eye protection, whether it's goggles or a face shield, mask, simple mask, or N95 respirators, as well as non-permeable gowns, gloves, shoe coverings, as well as some other things like hand sanitizer, things like that. But the basic PPE package is the majority of what the ask was.
Thank you, sir.
Okay, we have one more call in right now. Go ahead and ask that question.
Hi, caller. Go ahead and state your name, outlet,
Hi
and
there,
question.
Mary Plummer from iNewsSource. The family members of someone who tested positive are being told they are presumed positive and cannot be tested even though they have symptoms. Can you speak to why that's the case? And also, can you state the number of people in the county that health officials believe are positive right now who have not been tested?
Thank you for that question. When we identify a known COVID positive case, there is a standard interview in which we identify close contacts, and we're often able to ascertain that those close contacts do have illness. If they in fact have illness and they're not sick enough to require care at the hospital, we're giving the same advice to them that we give to other people in the community who have symptoms who aren't sick enough to go to the hospital. That is, they should stay at home until 7 days after the onset of their symptoms or 3 days after their symptoms have stopped, so that they are no longer infectious to other individuals. We can presume, by being close contacts of a known case, that they are in fact likely to be COVID cases. And with the extremely limited number of tests that are available, we can give them the proper advice and yet save those tests for those who really need it, i.e. the healthcare workers, those in skilled nursing facilities, and hospitalized patients in which a decision needs to be made about therapy or protection of those who are caring for them. So when we identify people who are possibly or even more likely to have COVID, but yet are likely to just simply recover at home with no medical treatment, which is true of 80% of people with COVID, we don't need to test those individuals.
And if I can follow up on that, can you speak to the volume, the numbers that are known of folks who are in that category currently?
We don't really know the numbers. I can tell you that anecdotally, we identify 1 to 2 individuals very specifically when we do these close contact investigations and ask those usual household members to stay at home. But as I've said in other interviews, again, this is the tip of the iceberg. Do I think that what's below the waterline is only 2 or 3 times? No, I think it's a lot larger than that. And I've just made a guesstimate of about 10 times as many, but we really don't know. Frankly, when testing becomes much more available within the next 2 weeks, we will have a much better answer to that question.
Thank you.
Okay, we have 2 more media calls. We'll go ahead and take those now.
Hi, caller. Please state your name, outlet, and question. Hi, callers. Please state your name, outlet, and question. Let's move on.
10 News.
Please state your name, outlet, and question.
Hi, this is Kimberly Hunt with ABC 10 News. We would like just to get some verification one way or the other. We received information into Channel 10 regarding the local Mission Valley VA office, and we wanted to ask, are you aware that there may be multiple cases in that office? If so, was there a communication gap that resulted in spread within the office and among their family members?
Yes, the cases that are at that location are known to us, and we are under an active investigation with the staff at that site. We have done some notifications through that through the VA and through their system. We believe that this cluster of cases has been identified. However, there may be more close contacts that are in fact identified as time goes by. But we are aware of those cases.
Dr. McDonald, if I may follow up, would that also mean the information that we were receiving was that there was some indication that it started by an infection from one of the homeless veterans? Would you be able to verify that?
We have no evidence that that's the case. I would say that it is more likely that when you see a cluster of individuals at a workplace that the exchange is between those individuals. Of course, we're concerned with this service which provides service to the homeless, as we are with all the locations that provide services to healthcare workers, to healthcare, when we see a number of healthcare workers associated with each other, whether there may be transmission to their clients. So we are unaware of any specific individual, however, that is a client of that service who is COVID positive.
And also for the employees, are you able to give them your opinion on the notification if they weren't satisfied with the timeliness that they were notified?
We are working with the organization on a timely notification of the employees of that location.
Thank you so much.
Okay, we'll go to the last phone-in we have.
Hi, please state your name, outlet, and question.
Yes, Will Huntsberry, Voice of San Diego. My question is for Dr. McDonald. And so you showed us the modeling earlier and flattening the curve out until May 6th, at which point we would surpass our kind of official capacity, not counting federal beds. It looks like that curve might keep going up in the chart. I couldn't really tell. Do we know if that's the peak of the curve? Do we know if it could go higher? We have about 8,000 beds right now, right?
Thank you for that question. Again, what I was trying to show in that graphic was sort of the immediate and important impact that every San Diego can make today to make that curve change, and to also show that the time that is bought will allow the system to, in fact, raise that red line upwards. We will be showing information over the course of the next few days, some information about modeling that answers, I think, the question that you're getting at is when the peaks might occur, given various inputs and changes that may be taking place as far as we call the non-pharmacologic interventions. There was a nice article actually in the Union Tribune which used the Penn model with inputs that were very similar to the ones that I gave for my presentation, the 20% hospitalization, the 9% ICU, and the 1% death rate, and 7-day time frame for being hospitalized, that actually showed complete curves of what would happen if we did nothing, which is we would be quickly overwhelmed, or if we did everything, which is to flatten that curve down so that the capacity was met. And I want to emphasize something that was mentioned earlier. People are thinking, how long do we need to do this, and should I keep doing what I'm doing now? And my advice is, you need to do more now. That is, really look at what you're doing day to day and ask yourself, is this essential? You need to walk the dog, but do you need to walk the dog and have interactions with many other dog owners in the park? No. Walk the dog, bring the dog home. If you need to shop, but do you need to shop every day? No. You probably need to shop every 3 days, bundle what you need to do, go out, make your shopping trip, come back. Every individual in the county has the responsibility and, frankly, the need to look at each of their activities and determine what is essential and pare down to those specific activities for this critical period of time. And that is what is going to buy us the time we need, flatten the curve, and allow us to handle which will be a large number of illnesses and, I'm afraid, deaths that are coming in the days ahead.
So you mentioned that there would be more info on when the peak might be and the magnitude of the peak in the coming days. Are you guys holding that back because the model is not as good as you want it to be yet? Can you just talk about more about why we're waiting on that information about how high the peak will go?
Well, again, the models that are out there and available, like the Penn model, have very specific, simple metrics that are used. But as we are learning, we need to apply the specifics of San Diego and what's being done here to a little bit more of a refined model. It may, in fact, show not too much difference than what the Penn model shows, but we are actively working with UCSD and with other groups to see if we can parse out what the specific interventions are that may be contributing most. Does school closure contribute most to reduction? Does teleworking contribute most to reduction? If we can pick the actual specific components that are having the most effect here locally, then we'll be able to get that information out to the public. But at this time, we really need to do it all because we don't know which is the most effective. And that's what I think the refinement of modeling is about, is understanding which of the components and what are the assumptions behind those models that in fact drive the outcomes. Again, lots of things that are assumed when you look at a simple model with graphs, and I'm not specifically a modeler, but I've worked with them enough to know that everything depends on your assumptions, and you need to challenge those assumptions, and we are dealing with a disease that we don't know everything about. And so some of our assumptions might be wrong, and therefore we need to have wide areas of latitude to look at the best case and the worst case. And that would overwhelm you, frankly, with lots of curves and lots of colors, and that's why we're trying to, again, keep it simple. The message for now is it is critical that essential activities only take place over this near-term period of time.
Okay, we're going to go to the text questions now. If there are additional media calls that are made, we will deal with those after we get done with the text questions. I believe we have 4. The first one is going to be directed to Rob Sills, our Director of the Medical Operations Center, and we'll go ahead and ask that question to be read now.
All right, thank you, Chairman Cox. Matt Boone from ABC 10 News has several questions, all related. Can you give an update on the county's supply of ventilators? How many are available through the healthcare system in the county? How many have been ordered or are on their way, and will that be enough?
The ventilators, the report I received earlier today, because we run this daily, is we have over half of our ventilators are not being used currently. I know of 2 healthcare systems, including one other, so 3 with the county that have placed additional ventilator orders with multiple manufacturers. And I believe the last part of the question, is that enough? I think Dr. McDonald addressed that previously very well. We don't know what the final number is going to be. We don't know how many we're going to need. It is our desire to have enough to judiciously put in place systems so that we can distribute the ventilators where they're most needed. We have also requested some from the state's cash. So we have a lot coming in multiple areas to increase that number that we have currently. But as of today, when I ran the report at 11:52 this morning, I believe, over 50% of the ventilators we have within the county are available for use as of right now.
Just to follow up on Rob's point about ventilators, we are doing everything we can to get as many as possible into San Diego County. But a key point for everyone to take away is, will we have enough is partially dependent upon the supply chain and the numbers that we're able to access, and it's partially dependent upon each and every one of us. Because if we all do the things we knew to flatten the curve, to slow the spread, then as one individual needs a ventilator, they can get a ventilator, they can get treated, they can leave the hospital, and that can be available to someone else. And so while we do everything we can to raise that line of healthcare capacity, we need everyone to join with us to lower the demand on the healthcare capacity, which is why we're reiterating our calls for folks to not only adhere, but enhance and do more to help ensure that we are slowing the spread. And one point on the modeling question, we are not in any way holding back any information as it relates to modeling. We are trying to get clarity. We're trying to get clarity about the situation on the ground, to better understand what is happening, to have increasing testing so that when we put forward and share things, we have a higher degree of confidence in a very uncertain time that there is some underlying basis for that information. And so we have a whole team working tirelessly on these issues and on these questions. And as soon as we have information that we think has some reliability to it based on the facts as we know them now, we will continue to share all that information.
You stay there and help me with this next question from Alexander Wynn from KPBS. Some residents around the Balboa Park area are wondering if they can still use the park for their daily exercise, such as walking their dogs, since the park is closed and it's their only green space nearby.
Our public health officer issued an order to local jurisdictions that said, if you cannot maintain social distancing in your parks and recreational areas, then you shall close them. Every jurisdiction has taken into account the situation and scenarios that they see and made the decision that they believe is most appropriate for them. For Balboa Park and the City of San Diego, we would direct you to the advice and guidance from the City of San Diego regarding their closures and what that means. For the County of San Diego, we feel that we have been able to maintain social distancing in the majority of our open space and recreation areas. Some very narrow trails, some contact surfaces with playground structures, some teen centers and areas where folks congregate have been closed, but the others of ours at the county we have maintained. But it is important to note that is because in the county jurisdictions we feel like we have had social distancing, physical distancing compliance, and we're asking the public's help and cooperation. It is important that you exercise. It is important that you get outside. But as Dr. McDonald noted, it needs to be done in a way that is adhering to those guidance. So as for the specifics of one individual city, we would have to direct you to that city for what their individual order means, understanding also that order and enforcement posture could change. And so ultimately, you would have to check with your individual jurisdiction.
We have 2 remaining text questions, and they're both going to be directed to Dr. McDonald.
Thank you. This question is from Morgan Cook, the San Diego Union Tribune. It's a 2-part question. Where do things stand with testing and infection control efforts at the Stellar Care Assisted Living Facility, and how many people have been tested so far? How many still need to be tested?
Thank you for that question. That specific facility is one of the facilities that has been identified as having a COVID case, either as a staff member or a client at that facility or a patient at that facility. And we had, for each one of these locations, sorry, I'm going back over here, questions are asked that way. For each of these locations, our standard procedure is to send out public health nurses, often with the CDPH licensing representative for that type of facility, to assess infection control and assess the need for continued testing. We had that visit at that facility this morning, and there are some tests pending, but I don't have the specific details at this time. I will say that we have worked in the last 3 to 4 years with many assisted living and skilled nursing facilities on influenza control. In fact, I think we have one of the most innovative programs in the state to be able to identify cases of influenza and then work with the facility to do infection control procedures, specifically to use proper PPE with patients who are ill, to cohort patients, that is, put them together in the facility if they have the similar illness, and to do other interventions such as congregate meal changes and a lot of very specific things that work on infection control with the facilities. In the last couple of years, we've seen tremendous cooperation and progress at these facilities, so that when we make these suggestions, we know that they happen rapidly. With COVID-19, we are doing site visits as a part of that investigation to ensure that those infection control activities indeed occur. And again, we'll have more information as time goes by with that specific location.
Okay, and I have a question from Paul Sisson at the San Diego Union Tribune. How many persons are currently under COVID investigation in San Diego County, and how many nosocomial coronavirus infections has the county confirmed to date?
So there's 2 questions there, one having to do with persons under investigation, which is somebody who has signs and symptoms of COVID and are awaiting testing. And we know that there are at least 24 that the county is aware of, usually on a daily basis, in which we are involved with evaluating them and getting testing through our public health lab. We don't know how many are actually under investigation in the hospitals, because when they encounter these individuals and do testing and give them proper guidance to go home and stay isolated, or in fact require hospital care, we don't necessarily learn about those cases until the results come to us. So I don't know how many of those are actually in healthcare facilities or in clinics across the county. And the second question had to do with nosocomial infections, which is infections that occur inside a healthcare facility, usually referring to illnesses that are transferred between patients or from staff to patients. We do know of several cases of healthcare workers who have COVID-19. The cases to date are primarily related to social groups between healthcare workers or travel. We don't have a specific case at this time that we know is related to work associated in a healthcare facility, but that is always an ongoing concern, and we continue to investigate each and every case that comes our way. And I did want to make one comment. We, again, are going to be changing the reporting that we have on our website that is going to be confined simply to San Diego County residents from this point forward, again, to be consistent with all other jurisdictions. So there will be a slight drop from taking the non-county residents off our rolls. Doesn't mean we're not monitoring them. It just means that it's the information that we are presenting forward so that when individuals are looking at one jurisdiction versus another, they can compare apples to apples rather than looking at an overall number that may not be accurate. A great example of that is one of our cases that died was an individual who was a San Diego County resident, was cared for and died in the Bay Area, and it actually led to some confusion as to how to account for that case. That is our case, that is our resident, and is in our numbers. But in order to not have that type of confusion, it's important that we make this change. Also, we've had questions about specifics of cases, ages and genders and locations, and those are specific data points that we do track over time. And it's important for us to be able to tell you something that is accurate rather than something that is immediately available. And it takes time to make sure that we verify all the demographic information on these individuals. So I did want to make that point too.
Thank you for your questions. As this crisis has gone on, we've highlighted great efforts by individuals and companies who've stepped up to help people, whether it's supermarkets opening earlier for seniors and those with disabilities, or distilleries making much-needed hand sanitizer. Today, I want to at least recognize a local San Diego company, ResMed. They normally make sleep apnea machines, but also produce ventilators for hospitals and home use. They plan to double or even triple the production of hospital ventilators to help during this crisis. It's steps like this, one by one, that will get us through this period. I also know that many of you that have been watching at home these briefings have been wondering, what can you do? Well, we've put together a chart that, or diagram that really focuses on things that people can do while staying home or at least maintaining the appropriate social distancing. We would encourage people to deliver meals. There's a lot of vulnerable seniors at greater risk amid COVID-19, and so we can help them and keep them safe and care for them by delivering meals to them, either through Meals on Wheels or by making phone calls and arranging to drop off foods at their doors and letting them know that the food is out there. You can volunteer or donate at a food bank. Food banks are in great need of volunteers to help pack and sort food. They are taking precautions to prioritize volunteer safety, and we encourage you to call either the San Diego Food Bank or Feed San Diego for directions there. You can support nonprofits. We have so many great nonprofits in this county that are doing great things. Give them a call and see how you can help them, either by volunteering, if it's appropriate, or by making donations to their efforts. Wellness checks. We would encourage you to maintain contact with your neighbors or with seniors that you are aware of. See if they need anything. Give them a call. Text them. Let them know that they are an integral part of our community and that you're there to help them when they need it. And then finally, donate blood. As we've mentioned before, both the San Diego Blood Bank and the American Red Cross are always in need of more donors, and particularly during this period of time, it's critically important that they maintain an adequate supply of blood. I want to thank you and want you to remember the mantra we've been passing out over these last few days: to live well, to stay well, and to stay home. That concludes our media briefing for today. We'll be back here at 2:30 tomorrow. Thank you.